I'd like to welcome everyone back. All of our presenters are here with us. We have Monica Arce from Virginia Garcia, CareOregon's very own Alexa Jets, and from the Doula Alliance, Kimberly Porter and Rabin Nolan. So we've got everybody back together here. I have been told that we've got the thumbs up to make this an unfiltered and completely spontaneous chat. So there's no rules. You guys can get away with murder with your questions here today. But let me go ahead. I'd like to go ahead and start with some of the questions that have come through in order. From Monica on here, we talked about a lot of different groups that take advantage of the programs there at Virginia Garcia and Centering Pregnancy. This question was, how do these groups look during the time of COVID? What have you seen that's different or that you'd like to comment on?
Well, unfortunately, we had to cancel all of our groups. So at this point, since we know this is going to be going for a long time, we are looking into seeing, into being able to do these virtually, as we're doing right now, as in a Zoom meeting with the parents at home with a computer or with an iPad. But we have to find some grant funding so that we can provide the parents with some form of technology so they could participate possibly. So that's where we're at. We're in the planning stages, looking for grants and looking for ways where we could possibly do this virtually.
Okay, thank you. And then one question also within the Virginia Garcia universe, is there a family planning program as well that you're able to comment on?
So Virginia Garcia has signed up for the reproductive health programs through the state. And so we have been able to provide birth control as needed for our patients. It's covered by the state through that program. So all of our sites participate in that program. All our pharmacists participate in that program. So birth control is something that is covered basically for everyone, unless they already have a tubal ligation or things like that.
That's excellent. So regardless of location, that's something that
everyone
can avail themselves of.
Yeah, and it's actually one of our measures that we report to the state is our one key question measure is how many of our patients that show up to any clinic get asked if they're planning to have a baby in the next year, and if they are they on prenatal vitamins, and if they're not, what is their plan for contraception?
Excellent. That's wonderful. That's great news. And then this question came from Sophia at Outside In. She mentions that we don't provide OB care in our primary care clinic, but is interested in learning more about how they can ensure appropriate follow-up care and coordinated care for their pregnant patients in primary care, especially now during the time of COVID.
Yeah. So for us, it's been seamless because not only do we provide the care in hospital as well as at the clinic. So we know when our patient's getting discharged and are able to bring them right into the clinic. Before they leave the hospital, we already have an appointment set up for them for their baby weight check and for their 2-week check with baby. And the same providers that are seeing the patients outside our system are the ones that are seeing patients in the clinic. So if our patient goes to a different hospital, our team assistant is always looking for patients of Virginia Garcia that left the emergency room or left another hospital through, oh my goodness, I don't remember right now the name of the system. I think it's called Eddie. But our team assistant is always looking for where our patients have been in different hospital systems. Other things that we do to keep track of our patients is we have a patient list with all of our pregnant patients in there. And if they haven't been to care in more than 6 weeks, our team reaches out to them to make sure that either they have an appointment so that we don't lose them. Or so that they don't get lost to care. And our patients get rescheduled on the same day if they miss an appointment. So everybody that misses an appointment gets a call immediately and gets rescheduled as soon as possible. And there's a process to keep calling that patient at least 2-3 times to get them in. Those are the things we've done.
Wow, that sounds incredibly thorough. That's wonderful. That's wonderful. And then
Mm-hmm.
kind of a side question alongside that as well is, and I know that centering pregnancy looks a little different right now, that a few things have had to be
Mm-hmm.
suspended, but how, question was, how do you incorporate behavioral health providers into that program?
Yeah. So one of the sessions we have, two of the sessions we have in centering pregnancy. The first one involves how, when you become pregnant, how you think about your family dynamics and how introducing a new baby to your family makes you reflect on the things that you experience in your family growing up, what things you want to do for your baby in the future, what things you learned that you want to continue, and what things you want to change. And so those conversations can be very intense and emotionally engaged. And we have a behaviorist scheduled on that session to help us lead that session. We oftentimes do a mindfulness exercise at the end of each session. So we incorporate a little bit of that into centering almost every time. And the last session that we definitely always schedule our behaviorists for is a session where we talk about postpartum depression and our, postpartum issues after delivery, mostly postpartum depression and postpartum psychosis and anxiety. And so we have them participate in at least two of the sessions.
Wonderful, wonderful. I want to shift gears over to Raven and Kimberly. Quite a few questions. I think people were very excited to have you be on the panel here today. A lot of questions that are on here. Let me move over to doula territory for just a couple of minutes here. Do you know, either of you, how many doulas typically take Medicaid payment?
I just looked this up today, so I had current stats. If you go to the Oregon Traditional Health Worker Registry, you can search by worker type. If you search for the whole state instead of just for your county, it looked like there was almost 90 doulas, which is the highest it's ever been. It's still not like thousands of doulas the way there are peers or community health workers. But yeah, the list, it's growing. Even looking through there, I knew about half those doulas. It's still, there could definitely be more doulas of color on there for sure.
I just wanted to add, since that's kind of my lens with the diversity and equity, is that even there are lots of doulas that serve Medicaid clients that are not on that list. And so most doulas of color, most community doulas, they are serving Medicaid clients. So, we've really been encouraging, Raven and I have really been encouraging, like she said, more doulas of color to get on the registry. But I just want to clarify that just because they're not on there doesn't mean they're not serving Medicaid clients, because most of them are.
Excellent, excellent. And I have a couple questions here that seem very connected, so I'm going to try to see if I can phrase them so they link together here for you. This one question came from someone who's a medical interpreter, and they talk about when they were with a client at a woman's clinic. It felt that the clinic's patient navigator couldn't explain very well what the path was in terms of like interacting with like a midwife or doula as opposed to a medical doctor. And when the client had to choose which path to choose, they ended up, of course, opting for doctors. And then alongside that, there was somebody asking for clarification of, it begs the question, what messaging should folks bring to members or providers to support connections with doulas?
Yeah,
Big question.
Questions. Is it okay if I start with that, Kimberly?
Sure, go ahead. Yeah.
Yeah. So regarding the midwife or OB conversation, as far as just like informed choice for the client, doulas are a very big piece of our work is around informed choice and making sure clients know what their options are. So some of that might need to be like how to get, the health navigators to have that information to share as well. If I was having that conversation with a pregnant person, some of that comes down to what's available to them and if they are a low risk, category or if they're high risk. So if they have high risk factors, then yeah, they're going to need to be with an OB. But if they are a low risk person with, that they're planning on having a low intervention birth, then a midwife might be a really good choice for them. And then explaining what that care looks like and how, it can be more relational, a little more connected, and having a care provider who just sees through the lens of normal birth instead of problematic birth. You're going to have, not that OBs are just always looking for problems to surgically solve, but to have a care provider who can really see the spectrum of, oh yeah, this is really normal for birth, is incredibly helpful for reducing a lot of those intervention outcomes that we see.
That's wonderful. That's great.
And I also, I also want to add, in terms of, I think your question is, how can folks know more about doula care? And so I think over the years, CCOs and other folks have been investing and having this integration model. So that's kind of been, another question I think it's been posed as well, is what's happening with the doulas that, kind of came through the healthcare training. But that's part of the integration process, to be able to have a community, could be, Community Doula Alliance, to be able to partner with some of these clinics that we know that there's going to be high-risk pregnancies or any type of, medical concerns. But that's the whole goal, is to be able to make sure that there's more doulas on the registry, but then also that there's doulas accessible to be able to do the work, and then have those clinics or particular hospitals to partner with those organizations or hubs, whatever you want to call it. So there will be more information and knowledge, where that particular clinic would already have your brochure up, would have access to all these doulas kind of on a directory. So that's in the making.
Is that kind of true up with what I believe it was like a health share training that was initiating a program to support more doulas getting into play?
Well, that's, again, a continuum of investment, which a CCO has been having with the doulas. So part of the, which we did talk about the health share. We got a contract with health share through Birthing Way, and then also Kimberly Porter Consulting, to train BIPOC, Black, Indigenous, and, not really BIPOC, it was actually Black, Indigenous, and Latin women to become doulas. And so we started in October. We had, 21 doulas come through the program, and we actually finished on September 26th. So we're in the process of letting everybody complete their assignments and things like that. So that is the goal. And so I just got an email from the person that is the follow-up. So the next step to that is to be able to transition those doulas to partner with these clinics that we still need to identify. So then there'll be a direct link between these clinics and those doulas that completed the class.
I would like to volunteer Virginia Garcia to be one of those clinics, first of all. And second, I think one of the things that as a state and as a healthcare system we do very poorly at is explaining these things. And I think it would be awesome if the state took responsibility to provide these options to their clients who are on Medicaid and explain to them in a very, nicely written out, explained handouts or something that everybody gets, so that everybody knows their choices, right? Because if somebody is a low risk woman that does not need to be in the hospital and wants to choose home birth, that would be fabulous. For people don't know these things, right? People don't know what the difference is between a certified nurse midwife, between a family doctor that delivers babies, a naturopathic doctor that delivers babies at home, a midwife that delivers babies at home. There's a lot of options for patients that they don't know about.
And I think that's why I'm a big advocate for community doulas, because they help navigate that process. Early on, if a person, like you said, is low risk, they may go the midwifery route. A lot of African clients want to go that route. That's what they're used to back home. And so then they come here and they feel like, I want to become more American. So then they go the OBGYN route, when actually, midwife care has been probably most appropriate for them back home. And so, yeah, all of that. I think that's what doulas are there, is to provide education and support, to say, these are your options. These are your options. You can decide whatever you want, but at least be informed about all the options that are available to you. Yeah.
That's great. Look at this partnership and coordination coming even closer together, just because we're all together this morning. I wanted to add another question on here, and then we'll jump over to Alexa. We had a question from an RN care coordinator for the OHP fee-for-service line, and they wanted to express their thanks for calling out disparities for Indigenous communities for pregnancy. And they wanted to add to that, is there is a list of Native American doulas available that would be able to accept OHP and fee-for-service? Do we have a resource like that?
Well, there are some that are on the registry that Raven just mentioned, but I don't think it sparses out to determine what their ethnicity is or their racial background. But I know with us at the Community Doula Alliance, we definitely have access. We had 3 Native doulas come through our business class. And so one of them, well, I know one it's been on the registry for years. And then we have 2 that are coming through our class. So there, at least one is in the process of actually coming through to finish it on the registry. But in terms of, I don't know, and maybe Raven, you could tell me a little bit more about that. I don't know how, I don't think they, just like when you go, because I'm a big person about, hey, I want a medical provider that looks like me. So when I first moved here from Michigan and I asked, like, I need a Black OBGYN, they were like, we don't identify that. Like we don't have, unless you look at the wall, you know, when you go into these, like if you go into Kaiser or something like that. So I don't think they identify it. I don't think if you call as a member, call and say, I want a particular provider that is Indian, or I want somebody that's African-American, they don't specify that. But I mean, most people know who they are that are on the registry. But I know that's one of the missions that I have, is to be able to create a directory of those doulas of color that specifically provide culture-specific doula care.
Fabulous.
I will also add that on the THW recipe, the you know, where you go to find THW doulas and other care providers, it does sort by county and theoretically by race and ethnicity. It's not been great. It's like user features are not super clear. So while you technically can, it's very hard to sort, and they've had a lot of problems with that. So
Alexa Jett, I think I'd like to make sure you get equal time here this morning. Are you willing to open your mouth for a comprehensive Q&A exam here?
Let's do it.
Okay, let's see what we can come up with. This question would like to hear more about how CareOregon is supporting PCPs in conducting oral evaluations for patients.
Oh, great question. And I will put on my CareOregon hat right now. And so if any of you are in our networks across the state, thank you for joining. And an oral evaluation means a few different things to me. So are you wanting to look in the mouth and actually do an evaluation and an assessment visually? Or are you interested in doing an evaluation via like lifestyle assessment questionnaires or other type of questions? So in working with our PCPs, we would first identify really what is the goal and what's the population that you're looking to serve. If this is for the perinatal population, currently an oral assessment, which there is a dental code, it's D0191, it's an oral assessment. Currently, that is not covered for for an adult. However, if you are seeing children and and you take OHP, and 0 to 5-year-olds are covered for this assessment if you're a First Tooth trained provider in the state of Oregon. So First Tooth is Oregon's early childhood caries prevention program. And at CareOregon, I'm one of the trainers. We have 2 trainers that we work with our providers, our PCPs who see children, so that they can be reimbursed for that oral assessment. One of the additional things at CareOregon that we've done is we've extended the age for that benefit up to age 18. We didn't want any provider to feel that they couldn't provide an assessment for older children. And we also see that this supports the foster care medical home model, that foster parents are asked to do lots of exams at a short amount of time. And you have mental health, physical health, and then an oral health assessment. And if we have a pediatric provider who could do both the physical health and then the oral health assessment, because they're First Tooth trained provider, we didn't want to create a barrier. We wanted to increase access points, especially for the foster care group or families. So, but back to the original question, because that code, the assessment code, is actually reimbursable if you're First Tooth trained for children, what can you do for adults and other ages? So you might not be reimbursed to take a look in the mouth and follow some of the guidelines that the state has in place for OHP reimbursement there, but we could definitely provide support around some of more of those assessment questions. And what do you feel comfortable with in your practice to either ask or assess, and then do those next steps on how to provide a recommendation, and what would that referral to dental look like?
Excellent, excellent. And then you had talked a little bit about maternity list sharing for dental outreach, if I'm remembering that right, and care
Yes.
coordination from primary care perspective,
Yep.
kind of help facilitate these referrals. Sounds like that was
Yeah.
some people would love to hear more about.
And we would too. So back in 2016, when our Oral Health Steering Committee landed on an initiative to increase the amount of pregnant patients who receive a dental visit prior to delivery, we said, we don't even really know who our pregnant patients are. The way that the OHP bundled claim works is that oftentimes we as the health plan are not notified that patients are pregnant until delivery. And so all of those important preventive visits and education that can occur prior to delivery, that time is lost. So when the dental department landed with the Oral Health Steering Committee for all of CareOregon, this is an important population. We want to do some more outreach. It was funny, it was dental that said, well, how are we going to identify who our pregnant patients are? And so we started working with our prenatal providers to establish maternity list sharing, then working with our maternal child youth department and our other physical health plan medical leadership, and not just that, but our other departments internally at CareOregon. We said, wow, this is really valuable information, not just to get dental care, but what other resources do these populations need? What else are we able now to provide for support, prenatal support? So while this started off as part of the dental initiative, now we're able to work with PCPs. We can create our wonderful IT department can work with a provider's IT department to set up a secure file transport site. So an Excel spreadsheet can just be loaded, and then magically, somehow through the magics behind the scene, it shows up in a folder at CareOregon. So there is no risk of a PHI breach. We don't have to worry about an email going awry and not being sent securely. So that's one way that we can set up maternity list sharing. Other ways are through, if you don't have a large volume of prenatal patients, using the portal, which is more one at a time versus a larger volume where you can send a monthly cadence of this, uploading this into a secure transfer site. And we are very careful with the outreach messaging. We don't want to be abrasive. We're very sensitive to where a patient may be regarding pregnancy and pregnancy outcomes. So not just at CareOregon, but then also the dental plan partners, when they perform the outreach, their scripting is very careful, and we work closely to make sure that there's accurate timing.
That's great. That's fantastic. I'm just double checking to see if we have any other questions coming through. I had a couple folks that asked particular bits of question about coverage in terms of things like community birth and midwives, and I'm trying to see if I can get some clarity for those. So if you did ask those questions, folks, we're trying to see if we can get some more information from someone who can weigh in with a more specific answer, because it was more of a specific coverage question. So we want to make sure we're getting the right folks to weigh in on that there. I wanted to give all of you who are on the panel here today an opportunity. A lot of times, there's something that you're carrying around with you that's like a story that made a difference for people that you wish more people knew about. Something to maybe, especially in these crazy times that we're in, to help give a sense of direction and hope where we're headed towards. Do either of you have a story about the work that you do that it particularly resonates for you, that you feel like you think people would like to hear, that might be helpful? Monica, how about you?
Oh. boy, every single patient that I see every day has a story. So it's really hard to kind of, you know, come up with one, honestly. But we just had we just had a patient that we transferred up to OHSU with COVID-19 who was 33 weeks pregnant and just got intubated last night. So that's not hopeful, unfortunately, but, you know, I don't know. We're just going through some really intense times right now, and just trying to do the best with it. You know, families aren't getting as involved with the care and with prenatal care and hospital care, and that's just something that sticks with me. You know, I just don't know what it means for the next year, how that pregnancy is going to be processed later, you know, how that pregnancy is going to be processed by dads that weren't as involved as they should have been, and all those things, you know, a lot of repercussions for a pandemic right now.
And is it fair to say, I mean, this may be anecdotally, but just, you know, what you hear is that during our quarantine time, it sounds like one of the things that's been happening is more people are conceiving during
This is true.
so we're going to see a lot more folks moving into this realm over time. Is that seem like a fair assessment of what you're seeing?
Well, throughout last year, we were seeing about 40 to 50 new initial pregnancy visits a month. And these last months has been about 60 to 70. So it's been a considerable increase in number of prenatal initial visits. So December, January, and February are going to be very interesting. And we'll see if that continues.
Wow. Well, it's a little glimpse of the weather vane that's coming out
Mm-hmm.
there. I did want to real briefly address a couple of coverage questions. I know some folks had submitted some questions about coverage of community midwives and coverage on there. I don't have a lot of specific information because some of it may have to be like on a case-by-case basis, but I can let you know that I got some information that came through saying that so far, CareOregon's contracted with one birth center in the metro area with midwife-attended births. It's Women's Healthcare Associates, but that we're working on contracting with more. And an expectant mother would stay enrolled in a plan for a contracted birth center without disruption, which is why we are working on these relationships with these birth centers there. Another bit of information on that same topic, that CareOregon does cover certified nurse midwives. And we just need to get a little bit more information probably about the specifics of an individual coverage question. Some Medicaid health plans may have contracts with birth centers. So it's always good to check with that health plan to clarify what those options are and who the birth provider needs to work with around anything that's like a prior authorization or billing or things like that. And I know we're always willing to do whatever we can to clarify those kind of questions when they come out. But we always want to make sure we're dealing with it in a good, resourceful, specific way. So we always want to be there to answer those questions. But I'm just trying to be mindful of everyone's time here because it looks like we're at about a quarter of here. Friends on the panel, did you have other remarks or questions or anything that you wanted to make sure got heard today? We have a couple minutes before we send you out into the wild again.
Kimberly, did you have something to say? I didn't want to jump in ahead of you. You and I both started, I think, talking at the same time.
Well, I was just going to say, I mean, I'm in my life right now, I've been very reflective, and I feel like that I'm on a journey. And so you know, as I said in the presentation, I graduated from University of Michigan, which is one of the best social work programs in the country. And so I can say, as a trained social worker in graduate school, we were taught to be leaders and we were taught to change the world. And I actually believe that. And so over the course of the last 20 years, like especially coming to Oregon, like I wanted to do something to make a difference. And I feel like social work, reproductive justice, social justice, all that stuff really matters to me. And I feel like, you know, I didn't know what a doula was until I came to Oregon. And so like to just jump right into this work, even though I'm a therapist and I've, you know, been working with families and babies for over 28 years, like the doula work really matters and it makes a difference early on. That's a first start to not only a family's life, but also a child's life. And so my mission has been to be able to diversify the doula profession in Portland. And I feel like that has been successful. And that's why you're seeing, the Sacred Roots Doula program, you're seeing more doulas of color on the registry, you're seeing the creation and the investment of doulas of color with the health share contract that we have. And so I'm just really excited about being able to be a part of that, to be taking a lead in that. And also, other people are understanding the importance of being able to have a more diverse doula workforce to be able to address some of these disparities. And so it's just been a journey for me, and I'm just really excited about it. And so I want people to know that this has evolved over time, and it didn't just happen in 2020 during COVID. Like, we have really, in the state of Oregon, I've really taken the lead of addressing our maternal and infant disparities. And I think that we're cutting edge, and I think we're going to be able to be a template for other parts of the country to really take some ownership of how to be able, because this is a public health issue that we are dealing with. And so we can go from a social work lens, a public health lens, a maternity care lens, early childhood therapy, whatever you want to do, how you ever want to look at it. But I think we need to be honest about, that we need more diversity, racial and linguistically diversity, to be able to address these issues. So I'm just really excited about being on this panel and also being able to share our work together, and hopefully that more people will continue to invest in doulas.
Excellent.
Yeah.
Well, we're just incredibly grateful that we had the opportunity here to get everyone to share what their work involves and the incredible differences they're making. Alexa, you look like you have bated breath. You want to add something on there? Do it.
I wanted to address a comment that came through earlier that was thanking me for providing oral health for the doula community. And I've been in dentistry for over 25 years now. And when I first went into dentistry, it's like, it's a pregnant patient. You don't touch them. We didn't even call them pregnant patients. It was, pregnant women or pregnant mothers. And I want to give a shout out to, if anybody's from Planned Parenthood, I gave our Two Bright Smiles presentation to Planned Parenthood about a year ago. And afterwards I said, what do you have feedback for us? What can I take back? And they said, we don't, not everybody identifies as a woman. So in your presentation, you're saying pregnant women. So now it's like, this was valuable. And so we're learning a lot as we go. But back to the comment, so thank you. When I first went to dentistry, we didn't know how to provide care to pregnant patients. It was like, dentists were hands off. And now I love seeing how we've come full circle, talking about integration, talking about different provider types, and making healthcare more accessible in all different manners to our patients. And I think that's why we're on this panel, and that's why we are calling in and having these discussions. I feel really empowered with everyone else, and with Kimberly and Monica and Rabin here on this call. So I want to just thank all the other panelists as well. There's still work for us to do. And we have done, let's take a stop here and take a look and see what we actually have accomplished already as we continue further. So hopefully more integration work to come. Thank you.
Excellent. And I'd just like to add, before we send everyone out to the noon hour here, I know a lot of folks on the chat had some great questions, particularly in terms of coverage in the doula realm and things like that. And I just want to make sure that we address for everybody, okay? If you still have any questions that did not get answered today, or you need more specific information, we want to make sure that those questions do not go unanswered. So you can email us, and you can certainly email me, and I can be a point person to make sure that those questions go to the correct resource to help you. Carson P, like Paul, Carson P at CareOregon.org. And feel free, contact me, any feedback or questions or coverage specifics together, and develop these presentations and share what they have done with us. I'm so grateful for you making time to get this important message out. I just think about all the people who are experiencing pregnancy right now, who are going to benefit from what you all do in the future, and all those children yet to be. And it just makes me very excited that you're out there and doing the work that you do. It's makes me feel a little more optimistic for the world, thanks to all of you. So we're super grateful for that, and glad that you are the force that you are in our community. We'll make sure that everyone's slides get shared, so attendees don't have to worry about that. At this point, I'd like to say a fond farewell to our presenters here today, and thank you for spending time with us and for everything that you did to collaborate. And then for attendees, I'm just going to take a couple seconds, go over some final slides with you here today, and we will go ahead and let everyone go find some lunch on there. So thank you, presenters. You have been phenomenal. All right, a couple things on here real quickly. There is a link. You don't need to copy this link down, because I'm sending it out to everybody who was a participant here today. But we want to make sure you get your CME credit, however that works for you. In order to do that, you just have to go ahead and take a couple seconds and fill out a very simple survey, basically an assessment and evaluation of the learning objectives in this course. Let us know how we did today, and that's what's required. So it's going to take you all of about 2 or 3 minutes to complete that. I'll be sending that out, but if you don't receive it, just email me, carsonp@careoregon.org. Also, for my friends who are LCSWs in that social work realm, there's a specific survey. We're new providing credit for LCSWs and like occupations today. So it's a specific survey that you will need to do for that. Just email me and indicate that you need that LCSW survey, and I will make sure that gets sent out to you specifically from me. So you'll have access. Jump to those real quickly and make sure that we get everything taken care of. We typically do 4 meds eds during the course of a year. This has been a little bit of a different year this year because of COVID. We had to translate ourselves into a virtual distance learning program, but we believe strongly we still have the ability to provide a 4th segment to you this year, and that's under development right now. So I'm sorry I'm not able to tell you specifically what that content will be. There has been all kinds of interesting topics suggested. If it's a question of if we can get the right expertise together to marshal that for you in the amount of time that we have left this year. So if you're not already on our distribution list, get on there and we'll go ahead and update you as soon as we have a date in play. It's probably going to be the first part of December that we prepare our next course for you, but we'll let you know that as soon as possible. I always like to make sure folks know on the Meds Ed webpage at CareOregon, we preserve these sessions like you saw today on video. So once the session is done and we've done a little magic behind the scenes, post-production wise, those are available and you can play them at your leisure and share them with your peers. You don't need any kind of access or permission or logins or anything. They're just public links to the CareOregon Meds Ed YouTube page. But there's a huge library of past courses on there, and this one will be joining them. So you can share those with your peers. Thank you so much for your time this morning, folks. We look forward to seeing you at the very next presentation of CareOregon Meds Ed. Everybody stay safe, wear a mask, wash your hands, and enjoy the fall. We'll talk to you soon. Thank you for coming.